Prashant Shende, who's the business unit leading for Healthcare. You know us best by our brands, which are Listerine, Neutrogena, Orsal, Stayfree, etc. Like many more such brands. We are a very purpose-driven company. We believe we are driven by a purpose, which is the life and starting part of everyday care.
Seriousness of diarrhea and the mortality issues which crop up with it, we wanted to touch base and reach out to our most important stakeholder, which is the doctor. And we took this opportunity to convert the message of Diarrhea se Darr Nahi and making India a diarrhea-free country by reaching out to the doctors in the form of a pledge. The pledge was basically to ensure that the doctors are on board with us, educating their patients on the importance of diarrhea management and the role which ORS solutions play in their day-to-day lives in alleviating diarrhea. So what began as a journey almost 6 to 7 months back was to basically reach out to doctors, get their pledge through a digital medium and ensuring that they are aware about what serious disease diarrhea is and how it can be alleviated or removed, and partnering with the ABR and IBR team who helped us convert this public awareness campaign and the pledge that we are taking, we took from the doctors in the form of a national/Asia level record where over 20,000 doctors in just over 100 days were onboarded on our platform in the form of a pledge to make India diarrhea free. A very, very big thanks to Prashant sir for leading this from the front and ensuring that all our teams were going out and meeting the doctors, spreading the message of Diarrhea se Darr Nahi. A very big thanks to Avinash ji and his entire self-care professional team to basically go over and above their day-to-day jobs in ensuring that the message of Diarrhea se Darr Nahi is reaching to the doctors, and they are agreeing to be part of this larger than life public awareness campaign of Diarrhea se Darr Nahi.
Mrs. Seema Manikot. I'm pleased to introduce myself as the official representative from Asia Book of Records and India Book of Records. I'm here today to announce the results. Maximum doctors pledged for educating patients on diarrhea management. India Book of Records is committed to record making since nearly 20 years as on today's date. It is registered with the Government of India. IBR is affiliated to Asia Book of Records and follows Asian protocols as per the consensus arrived at the meeting of Chief of Editors of National Book of Records, Ho Chi Minh City, Vietnam. Asia Book of Records is a platform where the record holders of all major national book of records, including India Book of Records, Vietnam, Indochina, Laos, Nepal Book of Records all meet to compare, compete and claim the title of Asia Book of Records. Today, Asia Book of Records holds a strong database of over 40,000 entries. Now it's time to announce the record for India and the Asia Book of Records. Maximum doctors pledged for educating patients on diarrhea management. Kenvue India, JNTL Consumer Health India Private Limited set a record for the maximum number of doctors pledged for educating patients on managing diarrhea. This pledge was an extension of their public initiative Diarrhea se Darr Nahi, which aimed to improve awareness amongst the doctors about the critical role of ORS solutions in patients with diarrhea. A total of 20,057 doctors pledged. 20,057 doctors pledged through an online platform starting on January 8, 2025 to June 23, 2025, as confirmed on July 14, 2025. We extend our heartfelt congratulations to Kenvue India Consumer Health India for achieving this milestone by setting a record with the India and Asia Book of Records. This achievement shows their strong efforts to spread awareness about diarrhea management. We also thank the healthcare professionals who took the digital pledge and supported this important health campaign. I would like to add special thanks and congratulations to a few more key role players. Mr. Prashant Shinde, Kenvue Business Unit Head Self-Care. Prashant ji has been a strong advocate for Diarrhoea Se Darr Nahi public health initiative, for his leadership and support in driving this pledge campaign across self-care professional team. Mr. Avinash Kumar, Kenvue's National Sales Head Self-Care. He drives entire sales force in Kenvue. Unfortunately, he wasn't able to attend the event today. He drives 600 plus strong sales team that went beyond their day-to-day tasks to ensure that the message of Diarrhoea Se Darr Nahi reached as many doctors as possible to pledge their support for their important cause to fight against diarrhea. Akshay Ojha, Kenvue Marketing, is the manager self-care. He had conceptualized and executed this project end to end to reach 20,000 plus doctors and to seek their support for this pledge to fight against diarrhea. He is accompanied with his colleague Rohit from his team. Mr. Pankaj Mahajan and Ms. Gitanjali Sabikhi, Kenvue Global Corporate Affairs team, for leading from the front to conceptualize this public health initiative, ensuring seamless execution of Diarrhoea Se Darr Nahi public initiative across touchpoints. And congratulations to all of you once again for creating this record. Hopefully you should keep creating many more records and spreading awareness on health and for the general benefit for the world around.
Thank you so much, Ms. Seema, for the kind words. With that, I'd like to invite Dr. Prashant Shinde to speak a few words on this recognition, and then we will do the felicitation ceremony.
Thanks, Gitanjali, and thank you to all the visitors who are here today. Thank you for acknowledging the efforts that we have taken, and it's something that we have done together. So we are really proud of it. So today is definitely a special occasion for us, and it's something which gives us a lot of pride, joy, and also a sense of accomplishment. I think it's important to talk about why Kenvue is actually doing this in the first place. Why have we tried to take on this problem of diarrhea? What is diarrhea all about? Now, one important thing to know is that diarrhea is still a preventable, treatable kind of condition. But it is one of the most prevalent conditions in the world today. According to W.H.O, or the World Health Organization, there are 1.7 billion cases of childhood diarrheal suffering every year. And it is very unfortunate that even in India, it is the third leading cause of death, especially in children under the age of 5 years. Now, the WHO has done a really good job in terms of having protocols to treat diarrhea, having a standard recommended what we call as oral rehydration salts or ORS, which when given effectively, administered effectively, can really alleviate this burden. However, it is equally unfortunate that the amount of prescription and usage of ORS in condition of diarrhea is still at a penetrated in the country. One more important fact to know is that it is well proven that ORS can address diarrhea deaths 93% of the time. So it is something which is preventable, treatable, but just the awareness is something which we wanted to tackle. Now, with an aim to address this, and Kenvue, as the makers of Oral, we expanded our hydration portfolio to actually come with an ORS ready-to-drink formulation. Now, what this helps with is that for a patient who's suffering from diarrhea, they don't have to go through the trouble of making a powdered ORS, mixing, etc., which can sometimes create issues of osmolality and not treat diarrhea completely. A lot of research also shows that. And hence, we were able to come with a ready-to-drink, easily accessible, convenient product which can go out and we are able to offer a good offering for this condition. One part is the product offering itself, but the second thing is that we also wanted to really increase the knowledge of diarrhea and tackle it head on, and that's why we partnered with an NGO called PSI, Population Services International India, and we took on 2 states, which is UP and Bihar. These are the states where there is maximum prevalence of diarrhea in the country. We took 10 districts within these states, partnered with the local authorities, partnered with healthcare workers over there, with an overall goal of over the next 2 years, by March 2027, aiming to reach out to at least 5 million children who can get impacted by diarrhea, and then enable that we are able to get out of this burden that the country faces in a big way. Now, in this journey of improving health outcomes, reducing mortality, a critical stakeholder for us is the HCPs, or the healthcare professionals. And that's why we thought actually we have done the product part of it. We have partnered to have real impact at the ground level. But without the doctor, who's typically the first port of call when someone suffers from this situation, without a doctor, we cannot make true impact. And that's why our team went out, made sure that healthcare professionals who are seeing this condition day in, day out are also able to pledge their support of this initiative. And I am really proud of the efforts that the team has taken, but also equally thankful to the 20,000 plus doctors. I think it was 20,057 to be precise, who have partnered with us, who have pledged and really said that this is a issue or a health problem that we as a community should be able to tackle. So my sincere thanks to everyone involved, all our partners, all our HCPs, all our teams who have gone out and made this awareness possible. Over the next couple of years, we are quite confident that we can significantly move the needle in terms of alleviating the burden of diarrhea for our country. And I would like to end by saying that we started with Diarrhea Se Darr Nahi, but we will make sure that this initiative, which is Diarrhea Se Darr Nahi, truly becomes a big thing for India. And from a overall health outcome perspective, as a good company, as a responsible corporate, this is something that we will try and take concrete steps towards addressing even in the future. Thank you very much.
My name is Prashant Shinde and I am the BU head for self-care for Kenvue in India. Today we are gathered here today to celebrate a momentous occasion. Over 6 months back, Kenvue had partnered with an NGO PSI to launch an initiative called Diarrhoea Se Darr Nahi, aimed at addressing the huge burden that the country faces in terms of diarrhea. It's a big problem. There are a lot of deaths, more than 50,000 deaths under the children over below the age of 5 that happen every particular year. And we partnered with the NGO as this initiative to make sure that we are able to address this problem for the country. As a part of an extension for this initiative, we also partnered with a lot of healthcare professionals or doctors and took their pledge to join us in the fight against diarrhea. I'm quite happy to share with you today that more than 20,000 HCPs, 20,057 HCPs to be precise, have joined this pledge against diarrhea as part of the Diarrhoea Se Darr Nahi campaign or public health initiative that we have taken. And this has been considered, acknowledged and recognized as a record by the India Book of Records and the Asia Book of Records. And that's the occasion that we are here to celebrate today. We want to thank everyone who has partnered with us on this, including the huge number of doctors that have shown their faith, trust and dedication to fight this important burden which the country is facing today.
Yeah, I have come from, I'm representing India Book of Records and Asia Book of Records. So we have been doing this, helping people create records and helping the media promotion for the last almost 20 years. And we have more than 40,000 entries in our record. People across India and also across Asia, many countries in Asia. And here they have been able to create this awareness campaign, which it was digital. Though it was digital, it was through media. But a lot of doctors were involved to bring about the awareness of how to use ORS, and they had created a record of 20,057 20057 doctors got together for this awareness campaign. So we got this information. I mean, they approached us, and so we tallied the record in our back end with various other companies who have attempted such a thing, and or they might not have attempted. The back end team knows about it, and then we got together and we realized that a new record is being created. So we were invited to check the truthfulness. We checked it. We found it completely genuine. So we are here to I came here from our team to do the felicitation, and congratulations to everyone for having done that. The health awareness is very important.